Hi, good afternoon. Let me take out my eyeglass. I'm Dr. Lim, and here beside me is Jill. So, Jill, introduce yourself.
Hi, my name is TABIOS, and I am a patient of Dr. Lim ever since I also had my braces ever since 2021 when I was just 19 years old.
Wow, 19 years old. And how old are you now?
I'm now
How young are you now?
I'm now 23 years old.
Now 23. So, that's 3 years ago,
Yes.
right? So, Jill is here to share her journey when it regards to orthodontics. From ortho, which is the braces, down to wearing a retainer. So I'm very, very honored that she accepted my request to do a short blog regarding orthodontics. And here she is to share her own journey and story, her own very experience. Go ahead, Jill.
Alright, so as I said earlier, I started out when I was just 19. Previously, I've been going to the dentist, however, just for cleaning. And then when I went under Dr. Lim as an orthodontist, when she inspected my teeth, she found out, and we all found out that I had the need to have braces. And then because due to the apparently my due to I'm being premature, my mouth did not develop fully, and it's smaller than it should be. That's how my teeth became somewhat jagged or crooked inside the molar area. My teeth inside. On the outside, it looked okay. However, when we looked inside, which was previously not inspected before in my previous dentist, that's when we found out. That's when I needed braces. So
During the time you used to bite your tongue
Yeah.
and your cheek, and you couldn't really chew and grind the food. Okay. Go.
yes, so that being said, I also had due to that also my teeth slowly also it became jagged as well on the surfaces, and with that I had the need to have braces, which started all in all my journey to having braces and developing my teeth into the proper and best way it should be through the journey of braces. So
Yeah. Her tooth used to be short. I mean, it wasn't able to really erupt well. When you say erupt, lumabas. So bansot siya, parang dwarf. It's small, it's short than the usual, which is now her teeth are already at the normal range. You can see that in the slideshow. And during those times, her teeth had to be like, I have to put a GI, which is glass ionomer, on top of each teeth so that other unerupted teeth will have the chance to develop and to grow further. So, did it work on you, Jill?
it very much worked, but of course I would say it's no easy journey. It's something that you need consistency, perseverance, and willingness as well. And it's not just something to give up on, because it's also for the better of my teeth as well. And even in long term, because there are so many things that could have happened and could have turned out wrong if I didn't have braces. And braces is no joke at all. It's really needed. And the braces journey was not easy at all, but I would say it really helped me, and it is very much worth it and needed. As right now, my teeth are way, way, way better than how it was before. And honestly, I couldn't thank Doctor enough, because I wouldn't be able to know what happened and what's wrong with my teeth if it wasn't for her. Because honestly, it's been overlooked before, and with her, she was able to see that, and I was not, especially as someone who was not aware or uninformed with certain things, especially when it comes to the teeth. She was able to help me, and she was very patient with me, and not just tell me that I needed braces, but a lot more than that. Because through my journey of having braces, not only did she help me get braces, but I also learned as well why my teeth was like this, the reasons why, and even the small details about my teeth, not just the need of braces, but like how it's supposed to develop, even how to clean my teeth properly while having braces, how to chew, what not to eat, what to use and what not to use, because um, really taking care of teeth is a serious matter as well. And like I myself, I really do also value my teeth as well. So thankfully, like with doctor's help, I was able to better my teeth all the more, as I really want my teeth to also be better compared to what I was before, because right now, um, as you can hear and see, I'm currently wearing retainers, and I'm not sure, but maybe to some people retainers may be just for a 1 day, 1 week, 1 month, but no. These retainers I'm wearing currently, I will be wearing them for a lifetime, because the purpose of retainers is to retain how my teeth was from where the braces developed my teeth. The braces slowly and progressively develop my teeth into the shape that should be. So also properly, my other teeth at the back and other areas will be able to develop more and have space all the more. So that's also a lot of, there's so many purposes and details of braces, not just to straighten out, but so much more. For example, my molars behind, they couldn't grow before because my teeth were somewhat compacted. They were compacted due to having minimal space. As I said earlier, I was premature, so it did not develop as it should have developed. So, with the help of braces, it was able to give space to my molars to grow more, and with that, my teeth is in its proper and more normal, more developed form. And with these retainers, it is supposed to help my teeth retain its current and last form from how the braces, from what the purpose of my full braces journey is. And I would say that retainers are also not. It's not just a 1 day, 2 day. It's not an overnight thing. It takes consistency, because it is needed to be worn for my whole lifetime, because or else if I remove this and I do not continue to wear this, everything will go back to the way it was before, which declines, or which defeats the purpose of having braces. So that is why having retainers and wearing retainers consistently and religiously is very important.
Yes.
So yeah.
And there's also one thing. It is very necessary to have a proper checkup before introducing ortho or braces to any patient. You have to explain the reason why. So it has to be both upper and lower. It cannot just be just upper or just lower, because it will not occlude properly. Now in the case of GIL, every time I put any brace or any accessories to her teeth, what do? I explain that.
Yes. She explains every reason and even the process one by one, detail, so that I myself, it's not just her job as well to always keep track, but I myself, it's my teeth. So I also have to know and learn, be educated on how my teeth works, what's the purpose of everything that she's been putting in my teeth. Not just the braces, but the brackets, to the wires, to even the springs, and even all of the procedures that she's done, like not just cleaning, but for example, tightening, putting certain liquids or materials needed to help the betterment of my teeth. And not just that, but not only is she very meticulous and very detailed when it comes to the health of my teeth, but also in every procedure. For example, removing the braces. Removing the braces, it's not just removing it and that's it. Like that's done. Next is retainers. No, it's not. It's not just that simple. Because for her, she really makes sure that she really cares for the health of her patient's teeth and also mine. By, for example, when she removed my braces, she really made sure all the cement, all the glue, all of the materials that the braces had on my teeth was removed, especially not just the cement, but the stain as well. She really left no tooth of mine uncleaned, unchecked, and especially as, of course, the cement was hard. The whole time, my whole 3 years, it's been there on my teeth, and of course, it's already stayed on my teeth. So she really made sure that my teeth wasn't rough from the cement. She really made sure that all of my teeth was smoothly polished and it was cleaned properly, and not just my tooth itself, but even the gaps of my teeth. She made sure, because I didn't even know that at first. You'd see on the surface level that, oh, it's clean on the outside, but when she flosses the gaps of my teeth, there's so many debris coming out, and that's also the importance of her meticulously. That
And we have a camera.
yeah, she also has different cameras, and like one of them is a mini camera that she puts in my mouth. It really catches the inside of my mouth and the nook and crannies of my mouth and the gaps of my teeth to make sure that there's no debris left unclean.
Yeah.
So there.
So if you notice, all of you can see in this slide that there are, you can see the torque and angulations and the twisting of our teeth, the cross bites. But we never extracted any tooth. Did we extract any tooth?
No.
So that's the wonder. Here in Ngiti Clinica, Manila, no extraction when it comes to ortho. We never extract any tooth, because the moment that you extract any tooth, the more space. We are trying to develop the maxilla and the mandible, the bone in itself. If you're going to have it develop and you're going to extract a tooth, that will create a lot of spacing. And you cannot force the teeth to just, retract it and squeeze it and compress it just like that. Because for every gear of every tooth, which is the cusp, the one on top of their teeth, it's a gear. So it has a partner on top, canine to canine, premolar to premolar. If you're going to extract one tooth, then which of these teeth will be the partner of that missing tooth? And that is the start of TMJ problem. To all those who had tooth extraction, sooner at a certain age of your life, you will have TMJ problems. So in the case of our client, we are waiting for her third molar, and there's already one third molar that has come out and popped out already on a straight manner. So we are just waiting for her lower and her upper, because as she mentioned, she is a premature baby. So at her age, if you will see the x-ray, most of her third molar has not yet developed. See, she's still a baby. See? So here in Ngiti Clinica, Manila, we make sure there's no extraction. We make sure that all the teeth are in proper condition after we remove all the braces, and leaving no cement behind, because leaving a cement behind can cause gingivitis, halitosis, which is foul odor, bad breath, staining of teeth, cavities, and more on tartar and plaque. And one more thing, I make sure the patient is well educated already. Why? She gets to understand each pieces of material that I put in their mouth, to know the expectation, the outcome of how her teeth will turn out to be. So there is no worries, no question mark on the mind of the patient. Like, we don't do like putting anything in the mouth without anything, and then the patient will just come here, not even, I want the patient to know, to learn, to understand, and to expect what to be expected. And my patient is very diligent. She comes on time. She doesn't overtreat, because the moment you overtreat, that's a wonderful danger on your teeth, and most of the brackets gets to pop out. So I would like to thank you, Jill, for your cooperation, for your 3 years of patience, for your understanding. And Jill is a very intelligent girl, and she knows everything. She could even take up dentistry already, But anyway, Jill, so what is your last parting words to our viewers regarding orthodontics here at Ngiti Clinica, Manila?
Here at Ngiti Clinica, Manila, I would say not just the process Doctora did, but even just to the simple things that is very overlooked or often overlooked. For example, her materials that she uses, from my mouth guard to everything. For example, the scopes, all of the materials used and put in my mouth. It is all disposable.
Yes.
So it really shows that she really makes sure it's hygienic and it's per patient. Really, it's also to show that each patient is given proper and special care and proper to make sure that we don't share our materials here, because each patient is different,
Yes.
and that we would like to stay hygienic
Thank
here.
you for mentioning that. And also the upholstery, the cover of the chair, I have color codings. Like if you want pink the whole week, I have many pink covers. And most of my clients, they help me remove the upholstery because it's quite heavy. And I thank you for that also. So for now, we have a new set for Jill because this is her last day for checkup. And hopefully no problem issues. And I would like really to thank you for joining me here for this short video, and it's going to be very helpful for our viewers and future clients in ortho. So for you out there, those who are wondering about the difference between braces and retainer, they are highly different. As Jill has explained, braces is moving of the teeth, which is fixed, it's there, it's cemented. While after the ortho, which is the braces, after the braces, these are all ortho, under ortho, but after the braces, after removing that, after the cleaning and everything and all, you put the retainer, and that retainer is meant to retain. You don't adjust the retainer. It is to retain what has been there already and fixed, to stabilize, to let the bone become more developed, to make the bone more enhanced, and well as your teeth, they are going to be stable in the end, not moving anymore. So here, before we say goodbye, once again, if you have any queries, you just make a comment below or something like that. And for Jill, I really appreciate your patience, and I really like to say thank you. And I'm very happy also that your teeth turned out to be so good.
I would also like to say thank you very much po. And here, in Doctora's clinic and with her expertise as well, I would say super as an alagang-alaga kayo, and not a checkup, not a session goes by where she really makes you feel special as a patient, not from things to materials, even to everything that is needed for your mouth and your teeth. She really makes sure that everything is explained and understood well by the patient, and that you guys are properly cared for. And at the same time, as everyone has different teeth, she gives special care to each one of her patients as well. And she's very patient and understanding, and she really not just makes it feel like she's just orthodontist, but it really feels like she's not just there to put stuff in your mouth and then solve the situations in your teeth, but really meticulously make sure that everything is properly checked and properly solved. So there.
Thank you. And one more thing, whenever I clean their teeth, this tip of the scaler, we throw it out. Even it's too expensive, because I do not reuse it as much as possible. I refrain from recycling stuffs, and just throw. Even the tray that was put in the mouth of each patient before you get an impression, I give it to them because it's their personal tray. Nothing is recycled here. Everything is thrown. They even bring home their own stuff to throw away. Less garbage here. So anyway, Jill, say goodbye to our viewers now.
Thank you very much.
Thank you.
Goodbye, viewers.
Bye-bye. See you next time.
See you next time.
Thank you, Jill.